womb actually forms outside the uterus. There's tissue that is similar to the womb. It will form outside of the womb. That is what is called endometriosis. So what causes it? What are the symptoms? How do you know you have endometriosis? I've been trying to get pregnant, but nothing has been forthcoming in the last couple of years. Endometriosis could have been a factor in that. So we do have a specialist, that is Mr. Gonzaga Andabati, and he's already here to give us many of these details that we are clamoring for. How do you know that someone is infertile? Well, when I was looking at some research, especially in the United States, it affects around 11% of the Americans, those between the age of 15 and also 45. Yes, 11%. But what are the numbers right here in Uganda? Dr. Andabati shall be telling us more about that. And also individuals who are in their 30s and also their 40s that were more prone to developing endometriosis in that regard. It's going to be a multifaceted conversation, so please pitch in. Thank you for joining us, Ms. Andabati. Good morning.
Thank you. Good morning.
When do you consider someone infertile? Let's start from there.
Yeah, generally when somebody has been trying to conceive for 12 months, that's about a year, and they are not getting pregnant, we consider that to be infertility.
All right.
And usually for infertility, we prefer to refer to couple because you get pregnant when two are together. Yes.
So what causes endometriosis? What is it?
Yeah, endometriosis is a condition where the tissue, the normal tissue which is supposed to be inside the womb, grows outside the womb. And then it behaves exactly the same, and then it starts shedding blood periodically, and that condition is called endometriosis.
I'm looking at a situation whereby this person gets pregnant, but then the pregnancy it's outside of the womb.
Yes.
Do these conditions occur severally as a result of endometriosis?
Yeah, so what you
Ectopic pregnancies.
Yes, what you are describing is actually called ectopic pregnancy. Now, what happens is, as I've said, in endometriosis, those tissues which are developing outside the womb,
Yes.
they behave exactly like the same as the one which was supposed to be inside the womb. So every month the woman is shedding off blood from those sites.
Yes.
And this blood is not getting out of the body, and it's causing scarring, including around the tube. Now, scarring around the tube prevents the pregnancy from going into the right place, because we know fertilization occurs in the tube.
Yes.
And after fertilization, the embryo is supposed to move systematically into the womb and attach there to grow inside the womb. Now, if endometriosis kinks the tube, it will affect the movement of the embryo. And this is very important because now the embryo will get trapped in the tube and cause an ectopic pregnancy.
Wow.
Yes.
How many of these occurrences are common in this jurisdiction of Uganda? Is it so common?
Endometriosis is very common, actually. One of the biggest challenges about endometriosis has been the misinformation. Earlier on, people had been thinking, even including us during our training, we were told that endometriosis is a disease of the whites. But that is not exactly true. What we are seeing in the field now is between 2 to 3 out of 10 women actually have endometriosis. This is our population. It's quite huge.
When I was doing research, there was a strong correlation between menstrual cycles and endometriosis. Please, on a step-by-step basis, without missing any words, please explain to the viewer the connection between the menstrual cycle and endometriosis.
Yes, yeah, the connection is that endometriosis, as we said, the tissues which line the inside of the womb, they grow and develop in other sites outside. Now, they behave exactly the same way as the same tissues inside the womb, which are supposed to be shedding off every month. Yes. So that means as the woman is going through her period every month and she's having her period, those tissues are bleeding. And
they're staying inside.
They are staying inside the abdomen. And when they stay there, that is internal bleeding.
Indeed.
And that bleeding is a lot with clots and pieces of tissue and causes irritation inside. Now, when this irritation occurs, it's real painful. And it gets worse with time. As the months and the years go by, it's more debilitating, really.
Indeed.
Yeah, so it can really cripple the person and affect their quality of life.
The viewer who is watching Morning at NTV right now is like, okay, how do I know I'm having endometriosis? What are some of the signs and symptoms one could actually look at and be alerted that they could be having the ailment?
Yeah, endometriosis has a variety of presentation, but the commonest presentations are those of very painful periods. This pain typically starts right before the period, goes through the period, and extends even for some days. And this pain gets worse over the years. This is very, very typical. It gets worse over the years. And these are the women you find they have to miss their work days.
Indeed.
You know, and
she becomes less productive during her menstrual cycle.
Exactly. She has to be off duty. And sometimes their bosses don't understand this. They are really struggling. They are struggling. And the same thing happens to high school students as well, because endometriosis can start as early as 12 years of age.
I see.
So painful periods, real painful periods, yes.
That is before, like when you're getting into your period, the pain first kicks in.
Yes.
Terrible pain. Then 5 days later you get your period.
Yes.
And still the pain persists.
It continues.
And even after the blood stops flowing.
For more days.
Pain persists.
Yes.
Wow.
Yeah, it's that bad. And this pain is so much that you'll find somebody gives a story of taking all the painkillers and they have reached a point where now no painkiller is working for them.
Indeed.
Pricking pain, burning pain. They describe like there's fire in their pelvis. Yeah, so this is one of the commonest things, painful period. But it also reaches a point where they have no interval of freedom at all. The pain connects from one period to another, because one of the things endometriosis does is to cause scarring inside.
I see.
And tissues get clamped together. The intestines, the ovaries, the womb, the bladder, they're all stuck together in the advanced stage of disease. And that is constant pain. And it worsens around the period. And another thing is failure to conceive in these women, because with this endometriosis, it twists the tubes. And so it can cause blockage of the tubes as well.
The sperms can't reach the ovaries.
They can't reach where the eggs are.
Take place. Yes.
Exactly. And we have also observed recently that the scarring affects the quality of the eggs. And we've seen women getting into menopause earlier, and because of endometriosis. So it's a very widespread disease.
What about blood spotting in between?
Yeah,
Is it also a sign when you do have secretions of blood from your private parts?
Yes, so there's a form of endometriosis called adenomyosis. It's actually endometriosis, but in this case, the tissues, some of it enters into the muscles of the womb. Not the part which is supposed to have that tissue, but it goes a little bit deeper. And that is the one which causes spotting during when you are out of your periods. Yeah, sometimes. There's
also pain during and after sex. As a victim is having sex, there will be too much pain. And after that, explain that to the viewer.
Yes. So pain during intercourse, we call it dyspareunia in medical terms.
I see.
Yes, it's one of the key indicators of especially chronic endometriosis, where the scarring has fixed the tissues. The upper part of the birth canal is fixed, so that during intercourse, those parts are very, very tender. Yes, and so it happens. It's one of the indicators of endometriosis.
Another symptom, she can see, some blood when she's trying to urinate, frequent urination, and so forth. Yes.
Yeah. So that symptom happens commonly when the endometriosis goes into the bladder. You see, I told you that endometriosis, the tissues go outside the womb, and they can be in the bladder, and so you find they get bleeding from in the urine. Yes, and they can also get frequent urinary tract infections.
All right.
Yeah, some of these women who are moving around with urinary tract infections all the time, they go and test here, they have UTI. They go here, they test UTI. Some of those are endometriosis. They need to be evaluated further.
They need to be evaluated further. Go ahead.
Yes. Yeah, so the evaluation for such a thing is to look inside the bladder. We now have the capability to look inside the bladder. We call cystoscopy. So you can look inside the bladder and you see the typical endometriosis lesion, and this is it. And then you go for the treatment. Exactly.
Is it only endometriosis, or is it only menstrual cycles that lead to endometriosis, or could it also be aggravated rape? Can aggravated rape whereby internal bleeding happens lead to endometriosis? The fact that the blood did not come out, it only was collected inside the body and it stayed there for a couple of months. The victim did not seek help at the nearest health center for the doctors to ascertain that maybe there's something we need to remove. So those tissues of blood remain in there for months. Can that lead to endometriosis?
Not exactly. We don't think that is so, because first of all, we know the disease of endometriosis, that abnormal tissue going in those places. Now, the question is, what causes this? At the moment, this is being investigated. We know of some risk factors, but what you've described is not one of the risk factors. Yes. But we know some risk factors for this. One of the risk factors is genetic. We haven't known the genes yet, but we know it behaves in a genetic transmission way.
So you can get it from a family member?
Yes, yes. We know it runs in families. There's some genetic risk factors, so it can be in the daughters, in the parents, and there's that association we know. But also lately, we are beginning to see an association with the chronic pelvic infection. Chronic pelvic infection, and we think the chronic pelvic infection may just be a trigger for something which was already going on. Yes, and so these are some of the known now risk factors, but not the exact cause yet.
What about the stomach and digestive problems? Explain that to the viewer too, as one of the symptoms or signs that could be able to know that I have endometriosis.
Yes, yes. So now endometriosis can extend to any part of the body.
I see.
In the abdomen, it can extend to the intestine. Now, sometimes those endometriotic lesions go onto the rectum, which is the part of the gut which stores the fecal matter before you void. Yes, and so if it involves that part, it will give you a sensation of feeling full and wanting to go to the toilet all the time. Or it can cause some bit of obstruction of the gut, and that's one of the presentations. But it is an indication of a severe form of disease. And so usually that symptom presents as the disease is being neglected and not attended to.
Go on.
Yeah, yeah. So it can present with digestive symptoms like that. Yeah, sometimes it can even present with the blood in the stool. You know, you go to the toilet and maybe you have a bit of diarrhea, and you ease yourself, and when you look at the void, you find it has some blood. It has some blood in it. Yeah. So that is one of the presentations. Yeah.
Can the endometriosis disease lead to ovarian cancer or any other diseases on the body?
Yeah, so endometriosis initially, endometriosis per se is a benign disease. It's not a cancer.
It's not cancer.
It's not a cancer by itself. But we know that endometriosis also affects the ovary. Then very recently, we found out that actually some forms of cysts which result from endometriosis are associated with some forms of ovarian cancer. Yes, that is true. And that's why now in the management of ovarian cysts related to endometriosis, we need to assess the tissues which have been removed. And this should be really clear to the patient. You should explain to the patient. And we are in the process of educating our health workers about this. Don't throw away those tissues you remove from ovarian cysts. You must analyze them, because it could be an indication. And these cancers, if they are detected early, they can be treated. Yeah.
Does endometriosis, Mr. Andabati, go away after menopause?
Yeah, that's a very, very good question. It's a very good question. Now, endometriosis, the symptoms are related to the hormones. After menopause, the hormones go down, and so the symptoms actually go down. Doesn't mean the disease has gone out.
I see.
It doesn't mean, I want this to be clear, because that means if somebody has gone into menopause, but the person had endometriosis before they have gone into menopause, and now they want hormone replacement therapy. People may be aware about this, where you get hormones to treat the symptoms of menopause. You can actually revert the endometriosis. You can have it coming back. But otherwise, if you don't take hormone replacement therapy, you are okay. Yes.
Let's talk about treatment for this disease, endometriosis. Do you have any treatments, or do we just have the ability to reduce the chances of getting the disease?
We do have treatment, actually, very, very effective treatment, especially if these treatments are instituted. I want to make this clear that if these treatments are instituted in the early stages of the disease, the treatments are very effective. They range from medications. This could be oral medications, these tablets. They could be injections, but also ultimately in the early stage, you can remove the whole of the disease, and that's it. Yeah.
We were talking to some medical experts who told us you can actually reduce the chances of getting endometriosis if you actually reduce the estrogen hormone in your body.
Now, the management of endometriosis, especially the medical management of endometriosis, plays around with keeping low levels of estrogen in the body. Yes, and it is very, very true that you can actually reduce the progression of the disease if you keep your estrogen low. And there are many ways of keeping your estrogen low. For example, managing your weight, because the weight is one of the sources of estrogen. So we working out is one of the things, and eating well is one of the things. Yes, and of course, if this doesn't work very well, then we can introduce medications to lower your estrogen.
Alcohol?
Alcohol is one of the drugs which destabilize the body's
and increases estrogen hormone levels.
It increases estrogen hormone levels, and it can cause destabilization. So it's one of those things. Alcohol and smoking, we don't encourage them.
Indeed.
Yes.
What about drinks that have caffeine in them? Can they also increase estrogen levels?
Those ones you can't.
Sodas, green tea.
Well, those are unhealthy nutritional behaviors, but they may not exactly have a direct effect on endometriosis per se. Yes.
Okay, let's talk about diagnosis. It's really important for my viewers who are watching Morning at NTV. How is it diagnosed?
Yes, so the diagnosis of endometriosis has actually evolved, and we're at a stage where we are now, we can do it non-invasively. Initially, it used to depend on testing the tissue in the lab. Now it moved to looking at the tissue with the, what we call laparoscopy. But now currently and very recently, there are now ultrasound modalities which can really confirm this disease if it is done very, very well. So imaging, for example, ultrasound, which is available everywhere. Indeed. All we need is training to do it very, very well.
So you're checking for the ovarian cysts?
Exactly.
I see.
You can do it very, very well. And the ovarian cyst of endometriosis is very, very typical and easy to diagnose, really. So we shouldn't be missing it out. Yes, so ultrasound is very good. Now we have MRI available. This is another form of scan.
MRI, magnetic resonance imaging.
Yes, magnetic resonance imaging. It can even pick those small lesions, even those on the diaphragm, on the intestine. It's very sensitive, actually. Yes.
Medicine, hormonal birth control.
Yes, so the medical management of endometriosis. Well, I want to push behind a little bit about the diagnosis before I go for the treatment. Now, it's very important to know that the clinical diagnosis should be emphasized. What I mean by clinical diagnosis, we should make our health workers aware about this disease and the public aware so that they know and pick up this disease very early.
Indeed.
Because with the clinical symptoms, you can almost be 70 and 90% sure that this is endometriosis. So it's very, very, very important.
Indeed.
Yes.
What if you do go for these tests, the MRI, the imaging test, the ultrasound that you did talk about, and they do not find any ovarian cysts within your system?
Yes.
What then does the medical doctor do?
Yeah, so if the ultrasound and the MRI don't see any cysts,
but you still have the symptoms.
You still have the symptoms. Well, there are other things which can be seen within this. For example, with the ultrasound, you can see those areas where there are the scars. You could see them with the MRI and the scan. But then, if this cannot show anything, then you can do what we call laparoscopy. Laparoscopy is a modality of a procedure where you put some camera inside the abdomen. It's a procedure
in the
done
pelvic
in the hip.
area.
Yes.
To see the tissue.
Exactly. You can see the typical endometriotic lesions, and that is very, very diagnostic, and it will confirm it. But currently, the ultrasound modalities are so good that actually you would rarely have to go there. When you do when you plan the laparoscopy, you should be planning it with the aim of also treating the disease. That is to remove whatever endometriotic tissues are there as well, yes.
All right, then you did talk about the medication.
Yes, now,
Yes.
so we come to the treatment.
Birth control.
Yes, so there are array of treatments for endometriosis, both medical and surgical. Before that, now, for the medical, we have a range of them. The simple birth control, the combined oral contraceptive, and this is very cheap and available. Yes, so it is a very good way of controlling your hormones and making sure that you don't have the periodic bleedings. And it also controls the symptoms as well. Now, there's another form of birth control which has the progesterones only.
I see.
It's commonly given to mothers who breastfeed. You can also use that one. You just have to use a slightly higher dose of it. There are some specific medications like Diagnostic. Diagnostic is like a form of progesterone.
I see.
And it can also be used, and it is it's simple and is easily available. Yes. And so there are others which are injections.
Oh, yeah.
You can use them also to control your hormones, because, you know, endometriosis, as we said, depends on the levels of the estrogen as well. And then finally, you could do surgery and remove every endometriotic tissue, especially for those which have cysts. You can remove the cysts effectively. Yeah.
Do the gonadotropin-releasing hormones agonists actually work, Mr. Adebati?
Yeah, so gonadotropin-releasing hormone agonists. Now, these, if you look at, this is based on the concept of the physiology of the hormone production. Now, estrogen is produced by the ovaries. And now the estrogen is the one which makes these endometriotic tissues to grow and set and give you symptoms. But estrogen production by the ovaries is under the influence of some hormones called the gonadotropins from the brain, the FSH and the LH.
I see.
Now, there are ways in which we can lower the levels of this FSH and the LH, which are the gonadotropins. And one of the ways is by using the agonist, the gonadotropin releasing hormone agonist. Yes. And one of them available is called Luprodex. They do work, actually. Luprodex is a very good way of treating endometriosis. The only challenge with it is that you have to use it for some time, and then you might get symptoms of similar to menopause. But this should not be a worry, because it is a reversible symptom. Yeah, so you can easily go back to your normal state.
So if they help you do away with the pelvic pain, that's when you would know, oh, I do have endometriosis. Remember, you went to the doctor, you got tested, they didn't find any ovarian cysts. But this doctor gave you these agonists to help you with the pelvic pain. So if it goes away as a result of the medication, then that's how you know you do have endometriosis, minus the surgery, the laparoscopy that he talked about, and so forth. But then what are the other conditions, Mr. Adebati, that are connected or linked to endometriosis?
Yeah, so endometriosis, as I said, can affect any part of your body. It can affect any part of the body. For example, if it affects your ureters, ureters are the tubes which carry the urine from the kidney down to the bladder before you pass out the urine. Now, if that passage is blocked, then the urine will accumulate and have a backflow. And in a number of cases, we've seen that somebody can lose their kidney because of that. So endometriosis can be that severe. Endometriosis may also affect your lungs. I've seen some cases of endometriosis affecting the lungs. Now, the endometriosis of the lung presents in a very typical way.
How?
In a typical way, it's you get cough or you get chest pain during your period.
I see.
And sometimes difficult breathing. Some few people have they cough out blood. So if you have chest symptoms during your periods, you may have endometriosis, so you better be checked out. Yes. So it can affect the lungs as well. Yes.
Of course, here on Morning at NTV and during this conversation, Dr. Adebati, we did say that endometriosis can lead to an ectopic pregnancy.
Yes.
But what we didn't break down are the signs that someone could follow and say, I'm having an ectopic pregnancy. How do I know that things did go wrong? Yeah,
so ectopic pregnancy by definition is where the pregnancy grows outside the womb. Yes, and the commonest site is in the tube. Yes. Now, when the pregnancy grows and starts in the tube, the first thing that happens is the tube is so small and it will be stretched. That gives some pain. And it may reach a point where it actually bursts out. And so the person bleeds inside. Now, so the commonest presentation of ectopic pregnancy is somebody has missed their period for some days, just a bit, maybe a week or so. And then they develop lower abdominal pain. And this pain usually starts from one side. And it really comes all of a sudden. Within 1 or 2 days, it is getting worse, and the person can actually collapse because of the internal bleeding. So if you have missed your period by a few days, and then you start developing pain, which is starting from not in the center but from the side, and it's getting worse, and you're getting dizzy, you could have ectopic pregnancy. You need to be assessed.
Fertility specialist Dr. Adabati Gonzaga, please talk to the viewer before I let you go on the do's and don'ts when it comes to preventing or reducing the chances of actually getting endometriosis.
Yes, so endometriosis, the key message about endometriosis is that I want people to know it is very common in our population. And secondly, that it's very, very important to detect it very early, because that's when you get the best benefit, the most benefit of its management. And how do I know you have endometriosis? Painful periods. Painful periods which get progressively worse are not normal. Don't make them look normal, because you could have endometriosis. And if that is noticed early, we could arrest the situation. So you need to know this. Yes, and simple remedy is now available. All we need is to make the correct diagnosis. And remember, endometriosis can affect a lot of your life. Your quality of life, it can affect your fertility. So when your daughter is having painful periods, please don't push away. Don't tell her that you're faking it. No, she's having real pain. Let her be evaluated, because this could mean her life in future, her fertility life, her quality of life. So please pay attention to endometriosis. I also want to appeal to the health workers to take interest in understanding this condition. Not every pelvic pain is infection. Not every pelvic pain is fibroids.
Indeed.
Endometriosis is with us, and it is common.
Is it exacerbated by urinary tract infections, that if you have a UTI already within your system, you have higher chances of getting endometriosis?
Instead, what UTI does is it worsens the symptoms of endometriosis.
I see.
It can worsen the symptoms of endometriosis because, of course, endometriosis increases your risk of UTI, but also when the UTI comes in, you have serious symptoms of endometriosis.
That is Dr. Adabati Gonzaga, is fertility specialist. Thank you so much, sir, for having made the time to speak to us on this beautiful Wednesday morning after International Women's Day. Right here on Morning at NTV, we do not just observe one day, we continue celebrating and talking about the ills or the pain for situations that the women go through today, tomorrow, and in the future. Thank you so much for actually putting a stone on those efforts.
Thank you so much.
Indeed.
It's my pleasure.
And indeed, you're still watching Morning at NTV. We did drop a bombshell as Morning at NTV. That is Lieutenant General Muhoozi Kainerugaba, the commander of the land forces and the first son. He shall be retiring from the army. These are not our words, they are his words. You can go and check his Twitter account. And of course, the experts, the political experts are already talking, and they are breathing fire. They are saying this is Mr. Muhoozi setting himself for this stage in 2026. They say this is him, going for the cleared stage for him to contest in the next election in 2026. So is that the move that Muhoozi Kainerugaba has expedited, to move away from the army so that he can, go into these elections as a civilian?